Hello everyone, I'm Ella Huang, and this is the RCD ShareNet. Welcome. Today's session is a follow-up to the previous session talking about Canada Pension Plan disability benefits and its application. And today we will be focusing on the application form itself. So before we start, I want to recap a little bit of the key points we talked about CPPD last time. So CPPD is a monthly taxable benefits, a monthly payment that would give to the eligible applicants who are no longer can work at any types of job due to a disability. To qualify for the benefits, the individual must have a severe and prolonged disability and meet the contribution requirement. So if you missed the first part of the CPPD application, I hope that you would review it so that to understand better what I'm talking about now. So basically, the CPPD is approved based on the severity of the medical condition and how it affects your ability to work and also your daily living activities. And the benefits is there are two types, really, CPPD. One is the regular CPPD, and the other one is the post-retirement CPPD. When you want to get ready to apply for the application of the CPPD, you want to look at the forms first. So the forms are downloadable from the CRA and Service Canada website, or you can get it from CRA centers. I have the link to the website in the description, so take a look at that if you want to download the form. Basically, the form is like that. There are about 19 pages of the form, and as well as the medical report part, which you need to ask your family physician specialist to fill out. So getting ready to the form is very helpful to read about the instructions. And I have to say this form has given quite clear instructions how to proceed. And the first few pages are actually all talking about what is CPPD, who will be eligible, how can you be eligible, what's the process of application, as well as an explanation of the outline of the application form. To recap a little bit, other than the application form, you can also apply for CPPD on their My Service Canada account, which I also talked about in the previous session. And that is worthwhile to open that because other than applying for this benefit, you can also apply for a lot of other benefits such as old age security, Canada pension, eventually, from the federal government. So of course, the CPPD is one of that. And you can also use the website to track the progress of your application. So before we go on to look at that is, first of all, you download the form and then you look at it, get everything ready. So what you need to have ready to start your application is, there's some of the information here on the application form is you need to have your social insurance number. And also when you complete the form, you provide as much as possible the details of what they asked. And also sign and mail in, or submit it through the Service Canada centers. You can drop it off and they can mail in for you, or you can mail it in yourself to the location of your residency. Like in BC, we mail it to Yukon. So there are different, you can find all the addresses on the form. And then if you need more space, you provide on a separate sheets of paper, which remember, you need to indicate that is your application, so remember to write your social insurance number on the form and on the top of each sheet so that they know that. And of course, lastly is the medical report that needs to be completed by a healthcare professional, so such as your family physicians. Okay, now let us have a look at first slide. The first slide is section A. So you can see it on the screen here. I'm also looking at one. It's some basic information about yourself. So, social insurance number, names, address, date of birth, And then a little bit more information how, if they need to communicate with you, how would you prefer the communication method? So everything is there, there's nothing very tricky on this part. And you just try you need to complete all the necessary fields. And if you use the online application, there's exactly the same fields as appear on the application form. And the second one is slide 2. We look at that first. So slide 2 is about section B. Section B is a little bit longer. Section B is actually to ascertain your eligibility for applying for the application, because they actually look at your CPP contribution. Remember, part of the criteria is you need to make a minimum contribution to the CPP to be eligible to apply for the CPPD. So how do they decide that? And they used to, tell you exactly, how many years out of so many years you need to work. But right now, because of a different calculation of the CPPD, remember we talked about in the previous session that there's a base rate, and then on top of the base rate, depending on your contribution, they will add on to it. So rather than just saying, how many years and things like that, they look at your overall contribution, and you need to meet to make the minimum contribution. In order to determine that, is sometimes some people say, for instance, for female, if they became a mother, and then they the person may take time off from work so that can look after the child. So in this case, they may not have contributed in the the first for 5-6 years when the person is looking after the child. However, saying that is the person did contribute before, and maybe the spouse is contributing, then depending on the arrangement, this mom may still be eligible to apply for CPPD. So the case is kind of on a case-to-case situation, and then it is difficult to summarize everything. However, if you complete section B throughout, then they will be able to determine that. So this slide is talking about dividing the CPP contribution. There's for people who are a couple and maybe one has not contributed to CPP, however, the spouse has. So they may be eligible, depending on the situation, the marital situation, whether they split their CPP contribution or not. So, however, that is the information that may help you to determine. And we can go to slide 3. Slide 3 is talking about the if you work in another country, and then also they may help you with applying for the CPP. However, saying that if you have worked in another country and there is benefits that you can apply from another country, then they will need you to apply for that before they would consider your application. And the other part is, when you look at that, is whether you have children. So they do have a child rearing provision. So that is a little bit related to what I mentioned before, is the worker work less or stop working because have to look after a child, and they may still be able to apply for the CPPD if that is a need to do that. And then under the child rearing provision, then the child may be able to get additional amount from the CPPD. So basically, it is all depending on the child, on the family allowance or the child care benefits. So family allowance is among that. It is available before 1993. Then in 1993, they introduced the child care benefits. Then since then, the family allowance no longer available, and then they changed to child care benefits. So sometimes this is important because they use this to ascertain the eligibility of the applicant, whether can have the child benefit under CPPD. So the person who's claiming the family allowance and the child benefits is important. And sometimes even the person who's not claiming it, they may be able to get the child benefits under CPPD for the child if they provide the information. So we can also have a next slide to see that. Then you provide information of the child and who's claiming the family allowance or the child benefits. With that information, then the government can also see whether you're eligible to have the child benefits under the CPPD. Okay, so that is kind of mainly to determine how much you will get under CPPD. Now, section C, we can look at slide 5 for section C. So this is the key part that to determine whether you are eligible to receiving CPPD. So earlier we talked about how much to receive if you are approved. Now we're actually talking about the eligibility. So remember, the main thing here is the person cannot work. So what does that mean, that person cannot work? If the person has a medical condition, that will render the person stop working entirely. So, you need to provide the information of that. And also look at is whether the medical condition is prolonged and severe. Whether that is any records of hospitalization, medication taken, treatments used, tests going to have or have had, or other disability benefits, functional assessment, and things like that. So all included in this section C. So when we look at this slide number 5, is they ask you a bit more information. What is the condition that prevents you from working? And sometimes the person may not have stopped work completely, but that is an anticipated date. Then you can start the process of applying for CPPD because it takes time. And so a lot of that information here is actually, getting, you need to feel that this is not the medical report to be completed by your family doctor. This is actually to be completed by the applicant. So you need to get the information, like I said, the hospital, if that is any hospitalization records, the medications that you're taking. Okay, and the next slide will show you some of the treatments and tests. So what do you mean by treatment? Some of the treatment that people may have is like physiotherapy, chiropractic, osteopathic, massage, and even acupuncture. Those are the treatments that you're taking. One thing very important, they're not asking for all the treatments you have had or you're going to have, and all the tests the same. They're asking about the treatment specific to your medical condition. So if you put in the beginning and in the earlier slide, we saw that is the medical condition that render you stop working completely or will be stop working completely. That is the medical condition. So they're not asking for your, annual dental check, annual blood test. They're actually the treatment that's specific for treating or for testing for the medical condition that you're using to apply for CPPD. So that is very important to remember that, because sometimes some people may think, oh, we just put everything in, but it might be irrelevant. So you want to put the relevant information in. And then the therapy also including like talking to having psychotherapy, like the talk therapy, like the cognitive behavioral treatment, and or meeting with your psychologist. That will be some other alternative therapy like the homeopathic therapy. And the tests mainly is, of course, blood tests. That is pretty common. Then kidney function test, different function test, thyroid function test, and then diagnostic imaging, and all these tests that you have had or will be having because of your specific medical condition that you use to apply for the CPPD. And they also ask a little bit about the information on any other disability benefits. So this is crucial for people with long-term disability from the company they are working or they have worked before. If they are still on the long-term disability, then they need to report on this. And there are pros and cons to that. If you're receiving long-term disability benefits from the insurance company, that may affect your, the start date of your benefits or the amount of benefits you're receiving. So that may or may not, one way or the other, if you receive already from insurance company, it does not affect the CPPD. However, once you start receiving CPPD, your insurance company may reduce the amount that they provide you with. The pro side on this is sometimes if you have already provided all your medical reports to the insurance company for the application of your long-term disability, you can actually ask the release of those reports to Service Canada. then they know they don't need to wait for the report from your doctor. So that is a part, since you have already done the work, might as well request that and then they can send it. So if you decide to do that, you remember to sign the waiver form, the consent form, so that Service Canada can contact your your insurance company in order to get the medical report that is related to the medical condition. Okay, so that is you need to do that. Then the next slide, we will be looking at the functional assessment. So I didn't list out the entire thing. I put in the categories that they're asking. So here is they actually want to ascertain the severity of your medical condition that leads to the disability. And then they ask quite detailed information. So do your best and be honest in replying for that. So there are different areas. If that particular area does not impact you and that carries no relevance to the application, you can just check on the top. There's a checkbox on the top. When you check that, so you say that, that you're not affected by this area, so you can skip it. If you don't check it, then you need to fill out everything. So checking off the numbers, they're pretty easy to look at. They ask you, to rate yourself. Say, for instance, remain on your feet for at least 20 minutes. So whether you can stand for 20 minutes, then you can assess your ability by saying excellent, very good, good, fair, poor. Okay, so be honest about that, and then it should be related to the medical condition that you are applying with. The other thing very important is at the bottom, you see that then if you have any additional information, you want to include that. And I would suggest as much as possible, provide information and write it here. Say, for instance, you remain on your feet for at least 20 minutes. Is it on a bad day, on a good day, on an average day? You want to mention that. And whether that's going to improve or get worse. If your condition is progressive, and then it will, like the time that you could stand will reduce, as the time goes by, then put it there. And sometimes always think is what is the worst scenario, like can you do this and can you do that? A lot of people try to say, I can do this on my bad days, but think of the worst day of on my good days that you could do it, but on the bad days, can you do it? On average, whether you can do it 50% or more. So try to look at that and be honest with it. And they do provide some examples how to fill this out at the back of the application. I would advise you to look at them. I'm not going to read out the examples, but they are useful examples to follow if you can just follow the duration, the severity, and how it affects you, and sometimes how it affects your primary assessment, the functions or the secondary functions, so you can mention about that. Okay, so other than physical, they do have the behaviors and emotional abilities, the communication and thinking abilities, and then other daily activities. That's all in section C. Okay, now then we move on to section D. We can have a slide 8 about that. So section D is about your doctor and nurse practitioner. Those are the people who kind of know you well about your medical condition. The healthcare professional's name, address, appointment time, reason for visits. You need to prepare that and fill that out as much as possible. If you need additional sheet to have additional information, by all means, put that all in. But when you do that, remember, it is also specific to the condition that you're applying with, the medical condition, not any, if you're not your dentist and, if it is irrelevant to your application. And try to fill the information as much as possible, because a lot of times we think that this may not be relevant, but that may carry some weight in that. That is next slide, slide 9. We're talking about section E. Section E is about your work. This is also very important, is sometimes, especially for people who have stopped working for a period of time, they may not have all the information, but you need to get that. At least the day that you worked with that particular company, the name of your employer, the company, and the address, and then what kind of work. So those are all relevant information to include, because then they will be helpful to calculate the amount of the CPPD you will receive. And that is important because if you leave out anything, they may not have the information on that. So that is important to put in all that, get the information. Then the next slide, and that is F. Now this is more about the benefit for children. If you have children, remember the eligibility to claim the CPPD children benefit is you have a child or children under the age of 18, or a child or children under 25 who have registered in a recognized educational institution, then you can claim the child benefit for them. And it is a flat rate, so it doesn't matter how many children you have. That is only one rate they do. They do need all the information regarding the child. So by all means, fill out all the information. If you have more than 4 children, congratulations, then you need additional piece of paper to include that information. What happens if you don't have the custody of the child? Okay, so in that case, if you're not the legal guardian of the child, then you need to complete the form to say that, where you can get the information and whether, you give consent for Canada Service to contact the custodian parent, the guardian of the child. Say if you're divorced, that might be applicable to you in that. Okay, so the next slide 11. So this is important to include this part and include the right information, because if you're approved, then they're going to send you the money, the CPPD benefits to the bank through direct deposit. So the best situation to avoid to include a void check and then send it along so that they will have all the information. Or if not, you can ask your bank to get the information. If you know how to fill out the form, like the branch number, institution number, account number, by all means, just fill that out, but make sure you have the right information. And lastly, and then you need to give consent for CRA to share your direct deposit information from the bank to CRA. So you need to do that, and then so you click. So when they asked for consent, that the only useful response is I agree and yes. If you click no, or I don't agree, I disagree, that doesn't take you anywhere, because once you said that they're not able to check on certain pertinent information, then your application may not be successful. Okay, we can have slide, have we seen slide 12? We can have slide 12 is actually the consent. And then we can move on to slide 13 is the declaration. And this part is very important. A lot of people, they forget to sign the declaration and the signature, then it invalidates the application. So you must remember to date it and to sign it. And then for some people who are not able to sign physically, they can just mark a cross there and then have someone to witness the signing of the applicant. So those are the important things that we need to look at. Then after that, you have completed everything. So you're probably ready to go, to send it on. But remember is to complete all the information on every page. So the one thing that I notice a lot of people may neglect to do is to have the social insurance number on the top. So when you look at the pages, that is a social insurance number, and remember to fill that out. If you use the online application, or if you use the fillable application, not the paper one you get from Service Canada Centre, the fillable one that you download from the website, actually once you put in the social insurance number, that is the good thing about technology, it auto-fill every page. So you don't need to kind of worry about that. But if you use the paper form to do that, that's a bit of work, but remember to complete that. And then last but not the least, we want to look at slide 14. They actually have a checklist. And I always find it very useful to do the checklist, to look at that, just make sure, have you done this, have you done that? And that would remind you, especially with signing of signing the waiver, the consent, or the signature, the declaration. Those are very important. So I would suggest that you also look at the checklist as well, and to do that. So after you have completed this, then of course, if you need to send the medical report in, then you bring the medical report to your doctor to have them fill that out. So we can look at slide 15. The slide 15 here, that the entire form actually, other than the first part, 1 and 2, completed by yourself, the rest needs to be completed by the doctor. And also, if you use the paper form, they also have on top the social insurance number, the box for that. If you use the paper form and you send this to your doctor, I would suggest you fill out your social insurance number on every page, because doctors normally, they're too busy and they may not have time to do that. But the part 1 and 2, that is your personal information, you need to complete that. Part 1 is information about you, basically is your personal information. And part 2 is actually the consent form for your family doctor to release information to Service Canada. So you drop this off to your doctor, and then they will mail it in for you. And you don't, I'm not saying that you don't need to pay. Normally, the Service Canada will pay $85 per application for the doctor to complete the medical report. However, different doctors may charge differently. If they charge more than that, you probably need to make up the difference. So $85 is what the Service Canada will pay the doctor to do that. And if you have completed the form, the bulk of the application form, you actually don't need to wait for your doctor to send in the medical report. You can just send it in the form, the application form, either by sending it to the address listed on the application form, or drop it off at one of the Service Canada centers, and they will send it in for you. And if you do the online application, they still need you to print. So you need to download the consent form to release personal information, sign it, so because they need your signature on that, and then mail that form in. So even you have applied online, you still need to do that form, or you can drop it off at the Service Canada and they will send that in for you. So that is important to remember this. And then send in the form as soon as you have completed that, and let your doctor handle the medical report. Then some people will ask, how long do they take to process the application form? It varies. It depending sometimes on the time of the year. If it is a tax season, CRA may be very busy to look at the application, assess your application, maybe check with your doctor and stuff like that. It may take a little bit longer. Nonetheless, you just submit as when you feel it is needed to do that, and submit as early as possible. So thank you very much for today, and I've listed some of the useful web link in the description below. So I hope that you will continue watching the RCD ShareNet, subscribe to our YouTube account, like us, and give us comments and suggestions. Thank you.